But in the meantime, let's get started. If you are currently on Medicare, if you have helped a family member look into Medicare, or you're looking into it yourself, you know how confusing and daunting a task it is. So fortunately, we have an expert here with us today. Steve Bobrin is a co-founder of DelVal Senior Advisors up in North Wales. He's going to walk us through the different options in Medicare, explain exactly how to navigate it, and also answer questions. So Steve has done dozens of these seminars over the years. He appreciates and encourages questions throughout. So if you can type them into the chat box or simply raise your hand, we'll unmute you and you can ask the question. So don't feel like you're interrupting. Steve actually encourages it. So with that said, Steve, I'll turn it over to you.
Okay, thank you very much. Let me just share my screen here and then we'll get started. Okay, hopefully everybody can see that.
We're good.
So, before we get too involved in this and we talk about how Medicare works and what your Medicare options are, I want to talk about who should apply for Medicare and when. So, if you're turning 65, you may want to apply for Medicare. It depends. If you work for a business that employs less than 20 employees, Medicare is primary. Even though you're working full-time and have group health insurance, Medicare is primary. You need to get it. If you're working for a business that employs more than 20 employees, then even though you're 65 or older, you do not have to get Medicare A or B. They are both elections, and you will not be penalized. Okay. If you need to get Medicare turning at 65, then, and this assumption is that this person is going to want to get Medicare as of 9/1. And if that's true, you want to apply the 3 months prior to the month that you turn. If you wait until the month that you turn 65, you will not get it till the month after. And if you wait another month, there's a 2-month gap, and so forth. Medicare always starts on the first of the month, regardless of what day you're born. Unless you're born on the first of the month, then it starts a month early. Okay? If you're 65 and 4 months and you're still working and then decide you want to retire or come off your company group health plan, the rules are a little bit different. You can apply for Medicare about 45 days prior to the date that you need it. There are a couple of forms that you need. There's something called a request for employment form, which is to be filled out by your employer, showing that you're on a group plan between 65 and the time that you decide to go on Medicare. And there's a Part B application. You take both those forms to a local Social Security office, and obviously in today's world, we're not doing that. Number one, I have the forms, and number two, they can be faxed to Social Security, and we have that number as well. Okay, no questions so far. Let's talk about how Medicare works. So, Medicare A and B are purchased from the government. A is free, B is not. B has a base price of $144.60 per month. And we're going to let somebody else in. Okay? Part B can cost more than $144.60. If your joint income is over $174,000, you start to pay more for Medicare B. We can talk about that later. But for now, A is free, B is $144.60. If you're collecting Social Security, they will take that money directly out of your check. If you're not collecting Social Security, they will bill you quarterly for that. And when you get your first quarterly bill, they call them easy pay options. And you will be able to either pay monthly through an automatic deduction on your checking account, or you can pay with a credit card. Okay? Now, everyone who goes on or transitions to Medicare has to have Medicare A and B. Once you have that, there are 2 ways to buy Medicare insurance. There's something called a Medicare Advantage plan, and there's something called a Medicare Supplement. Let's talk about Medicare Advantage plans first. And what I want to do is give you an overview first, and then we'll get into some detail on how each of these work. Medicare Advantage plans to the government are called Part C. They are private insurance plans that replace Medicare A and B. This is a little confusing. If you buy this type of plan, you are not eligible or able to use Medicare A and B. You can take your card and put it in a drawer somewhere. However, you will still be paying the Part B premium. That is not going to change. Why? If you elect Part C, the government is sending money to this Part C plan every month on your behalf, about $900 a month. Why? They're doing that because they are no longer responsible for your claims. This private insurance plan is handling all that for you. When you go to see a doctor or any other type of provider, you must make sure that they accept your plan. The fact that they accept Medicare is not going to help you. They must accept the plan that you've chosen because you're not using the Medicare network at this point. Most of these plans will offer a Part D prescription card. Think of D in drugs. Sometimes there's an option to waive it, but if you do, you cannot get another prescription card somewhere else, and you will pay a penalty, which we will talk about later, if you try to come back into the system. Many of the Medicare Advantage plans offer some added benefits like discount vision, discount hearing, and discount dental for an additional cost. All right, so that's one way to go. The other way to do this is to use original Medicare A and B as your primary source of insurance, and then you would buy what's known as a Medicare supplement. Sometimes they go by the name Medigap, but it's just two ways to say the same thing. And you would buy one of these, and they fill in what Medicare doesn't pay. To what degree depends on which plan you pick, which we will look at shortly. No Medicare supplements offer prescription coverage, so you're buying a Part D standalone prescription card, and that you're buying one based on the prescriptions that you're taking. And we'll take a look at that shortly. Some Medicare supplements offer some discount hearing and discount vision built in for no additional cost. It just comes with the plan. Okay. Now, an easy way to remember this plus this is, if you think back a number of years ago, many people had Blue Cross, Blue Shield, Major Medical. And back then, Blue Cross covered the hospital, Blue Shield covered the doctors, and Major Medical picked up that Blue Cross and Blue Shield didn't pay. Well, in 1965, when Medicare first started, they patterned it after something very specific. It was Blue Cross Blue Shield Major Medical, and so it works the same way. So Part A covers you in the hospital, Part B covers all the outpatient expense, and the supplement picks up what A and B doesn't pay, just like Blue Cross Blue Shield Major Medical. In 2005 is when the Part D prescription card came around. Prior to that, seniors were on their own to get their own prescription. So finally that came out. Okay. If you're enrolling in Medicare A and B together, you can do it through this web link. And you don't have to, those forms that I referred to earlier, you don't need those. You're going to apply right online. They will require, it's part of Social Security's website, they will require a username and password if you haven't created one for that site in the past. But it'll take you 10 or 15 minutes, so you can apply right online. All right, that's the overview. Let's take a look at a little more detail on Advantage plans. So Advantage plans are always going to be a form of managed care, either an HMO or PPO style plan. Always, always, always. With these types of plans, they are federally regulated. So why am I telling you this? This open enrollment that you see so heavily advertised on TV, where everybody's happy and they're making their Medicare choices and all that stuff, is a federal program. And it's sort of vague. They don't really tell you what you can or cannot do. But I'm telling you that that open enrollment program is for things that are only federally regulated. This is one of them. So Medicare Advantage plans can be purchased or changed from one to another during open enrollment, which is October 15th through December 7th. That is the only time you can do that. As a matter of fact, that's the only time you can get out of one of these plans. So going back, again, there are two forms of managed care. If it's an HMO, it may require referrals. Some of them do and some don't. PPO plans never require referrals, and you can move about the network as you see fit. But obviously there's better, and in-network is where the best benefits are. And in HMO, there is no out-of-network benefit, and even the ones that don't require referrals, the doctor that you see is capitated to certain labs and other facilities to get certain types of testing or medical services done. With these types of plans, they have co-pays, co-insurance, and out-of-pocket. Each in these, remember I said earlier, they're designed by private insurance companies, and so each company gets to design the plan the way they want. What I did here is put together a list of things that are common to all. What's important to note here is that you can spend as much as $6,700 a year in out-of-pocket costs. That's what it was in is in 2020. I did read recently that by the way, it's been the same number for several years, and next year it's going up somewhere between $7,200 and $7,500 a year. And that number, this $6,700, excludes whatever you're spending for drugs. Okay? Now, if you have an HMO style plan and you travel, let's just talk domestically at this point. And let's say you want to go to Florida because you want to get out of the cold weather. Well, if you have an HMO plan and you're in Florida, you're going to be covered for emergency and urgent care only, because the network is local and there is no out-of-network benefit with that type of plan. If it's a PPO style plan, it will depend. It depends on which plan you choose, what state you're in, and sometimes even what part of the state you're in, on whether there's in-network coverage or not. Okay. These plans will have a limited regional network. Doesn't matter what company, that's how they work. And they come in what I'm calling 3 general premium buckets. You'll see heavily advertised on TV, a plan that's somewhere between $0 and $20 because it looks so attractive. There may be a plan that's $25 to $75, and there can be a plan with some companies that are $100 to $200 or more. And as you spend more money, you're going to get a better plan, generally speaking. Okay. Any questions on Medicare Advantage? By the way, we don't have any questions yet. Is that correct?
Yeah. So okay. You're in the process of answering the question that we do have. So. Oh,
okay. What was the question?
Well, the first one is which is better, the supplemental or the Advantage?
Okay, so I'll go over the supplement and then I'll give you my view on it.
Okay.
Okay, so let's talk about Medicare Supplements. Medicare Supplements, number 1, I want you to read this. The annual Medicare open enrollment period, October 15th through December 7th, does not apply to Medicare Supplements. Many people are surprised to hear that. Why? Medicare Supplements are regulated by the state you live in. Remember that open enrollment is a federal program, and because this product is state regulated, it's not part of it. When you get Medicare, primarily B is what it's really based on, Medicare Part B for the first time, you will not be asked any health questions, and there are no pre-existing conditions to be concerned about. You will get it automatically. You can change your Medicare supplement any time of year. But the next time you change it, you will be asked health questions, and you can be accepted or not accepted based on the severity of your health. So that's an important thing to understand. Now, while these plans are state regulated, the federal government did design them so they're standardized. So it does not matter what company you buy it from, it's the same plan, and it pays exactly the same. If Medicare says it's an eligible expense, they will all pay. If Medicare says it's not an eligible expense, it does not matter who your supplement is through, they are not paying because they are only following what Medicare says. When you buy a Medicare supplement, you are not buying a network. Medicare is the network, and the supplement is doing just that, just supplementing Medicare. So any provider that accepts Medicare, by default, accepts all Medicare supplements. Okay, now, you notice we were talking about Part A, Part B, Part C, and Part D, and there happens to be Medicare supplement plan designs, A, B, C, and D as well. But they don't have the word part in front of it. So earlier when we looked at those parts, they are part of the Medicare program. These are Medicare supplement plan designs. So when you look at this chart, and what we did is we took the government chart, recreated it, put some color to it to make it a little bit easier to understand. And how you read this is, if you see yellow in a block, that means they don't pay for anything over here on the left. If there's a check in the block, that means they cover anything here on the left, 100%. Otherwise, you will see a percentage in the block. And by the way, we footnoted both of those things right here. There are 3 plans in dark blue, G, N, and F. They are the 3 most popular plans that people buy. Why? Because when you look at the benefits and you look at the cost, they just seem to make the most sense. And by the way, not every company sells every plan, and not every plan is offered in every state. However, those 3 plans seem to be offered almost universally. F is the best plan you can buy. Now, if you notice, everything is checked off. That means between Medicare and the supplement, if you need inpatient care or outpatient care, you will pay nothing. No copay, no deductible, no coinsurance, literally nothing. This plan is now only offered to people who turned 65 prior to the 1st of this year. So for anyone who's turning 65 or has turned 65 or is turning 65, starting January of this year or later, this F plan is no longer available. Why? Well, for many, many years, this plan was the most popular plan because nobody paid anything. The government has decided that because people didn't pay anything, utilization is too high and they don't want it around anymore. But because it was so popular, they didn't want to just axe it and take it away, so they cut it off. And they said, all right, anybody who's already 65, you can have it, but anyone new, it's not an option anymore. All right. So even if you don't have Medicare right now, but you're over 65, it is still an option. If you look at Plan G, the only difference between Plan G and Plan F is that Plan G has a yellow block. And when you read across, it says Part B deductible of $198. So both plans pay 100% in the hospital, but for anything outpatient, you pay the first $198 per calendar year of expense as incurred, and then it pays 100% after that. I will tell you that this Plan F costs more than $198 a year to have than this Plan G does. So you'll be spending anywhere, and I'll tell you, depending on the company, you'll be spending anywhere between $300 and $1,000 more to have an F plan to cover $198 deductible, which I'm sure every financial planner here would not want you to do. And I'm sure you wouldn't either. So the Plan F, even though it's not available for anyone who's turning 65, you just wouldn't buy it. It just doesn't make sense to buy it at this point. Okay. Plan N is also a good choice. So Plan N also has the $198 calendar year deductible. Once that deductible has been met, you pay $20 to see a doctor. That would be any type of doctor, primary or specialist, and $50 to go to an ER or urgent care. Now, you see that Plan N does have one other yellow block, and we need to talk about that. If you read across, it says Part B excess charges. So what is that? First of all, it's Part B, so it's anything outpatient in nature. Let's use a doctor as an example. If a doctor accepts Medicare and accepts assignment, so he's accepting Medicare like any other insurance plan in his or her practice, and that doctor is accepting payment directly from Medicare without you getting paid and then paying him. If both those things exist, then the doctor must accept what Medicare allows. If that same doctor accepts Medicare but does not accept assignment, most states allow that doctor to bill you 15% above what Medicare allows. At the bottom here, footnote number 2, it says these states do not allow excess billing. There's only a handful of states that is applicable to, PA being one of them. So what that means, it's not where you have the service provided, it's where it is where you have the service provided. Where you buy the plan is not going to be a factor. So even in the states that allow the excess billing, about 90% of all providers that accept Medicare accept assignment. So even in the states that allow that excess billing, it's only about 10% of the outpatient community, medical community, that could actually or would actually bill that 15%. And so the Plan F and Plan G pay the excess charge if you happen to encounter it, where Plan N does not do that. So we just need to know how that, that differential. For some people, I have some clients that barely leave the state, they hardly leave the street. So if you're really not someone who travels, Plan N works great. And I think it's really well priced. Now, Medicare is the largest network we have in this country. It's larger than any insurance company network. So you will be hard pressed if you're traveling around the country looking, and you need to get a doctor, you'll be hard pressed to find a doctor that doesn't accept Medicare. Why? Medicare is a really good payer. It pays better to these providers than this stuff does. This is a negotiated price. I guess to some degree this is too, but Medicare is a better payer than the managed care programs, so it's very widely accepted. Down here is the web link if you wanted to find out if a doctor or hospital accepts Medicare. That's where you would go. Obviously, you could call the provider and ask them if they accept Medicare as well. Okay. If you're traveling overseas, Medicare doesn't pay anything if you're traveling overseas, but there is something called a foreign travel emergency benefit, and it's a standardized benefit. It's a $250 deductible. They pay 80% to $50,000 lifetime, and anywhere like you'll see that the G, the N, and the F all have a check, which means any one of those would have that benefit included. Okay. Any questions that I'm missing? Okay.
Yep.
Okay. All right. Let's talk about Part D. And by the way, Matt, you asked me a question a little bit earlier. From my perspective, do I prefer Medicare Supplements or Medicare Advantage plans? I think you asked me that a little bit earlier. Is that correct?
Correct.
So in my view, I think that Medicare Supplements, number one, it's bigger network, easier access to care because no one's going to ask you for a pre-authorization. There's no pre-admission testing. The insurance company is not getting in between you and the doctor. As long as the doctor says you should have it and Medicare says it's an eligible expense, you're going to get it. Excuse me. Secondly is, if you're traveling, it just works easier. And most of our clients end up with a supplement. We have both types, obviously. It can't be an advisor and only have one, but the majority of our clients end up with a supplement. There's much less out of pocket with this. And if you end up starting out with an Advantage plan and start to have a lot of out of pocket, that may mean that your health now might preclude you from being able to get a supplement later. I think it's easier to start out with a supplement, and if later on down the line you want an Advantage plan, you could get it, but you may not be able to get the supplement again or get it, period, if you start out the other way. So in my view, if you have a choice, I think the supplement is absolutely the way to go.
Steve,
Okay.
why do people select the Advantage? Is it because it's cheaper?
I think there's two main reasons that I see. One is that it's going to be cheaper because they have some that are even zero premium or a very small premium. And it depends on how you feel about your healthcare. That's very personal. Some people maybe don't use healthcare very much and figure they're not going to use it. I'm not going to spend the money for a supplement. But you know, in our practice, we have somewhere between 1,600 and 2,000 Medicare clients. I would say about 100 to 150 of them have the Advantage plan, which means most of them have the supplement. Statistically speaking, if you look at all the Medicare recipients in this country, about a third of them have this type of plan, which means 2/3 don't. They have a supplement. So again, I think this is the way to go if for most people. All right. Any questions on that? Do you have any questions on the supplement? No?
Nope.
All right. Let's talk about Part D prescription card. So again, if you're buying an Advantage plan, you don't get a choice. It's the one it comes with. When you're buying a supplement, you do have a choice. In the 5-county Philadelphia area, there are 31 prescription cards to choose from. And most people go, wow, it's a lot of cards. How do you pick one? You are looking for the plan not with the lowest premium, not with the lowest deductible. You're looking for the plan with the lowest overall cost. An overall cost is a combination of the premium you're going to spend to have the card, the coverage, and what your drug card copays will equal for the year. So you add both of those together, Medicare factors in the deductible, and you're looking for the cheapest one of those overall. The government creates a minimum standard for all private insurance companies who sell Part D cards to run with, and that's what you're looking at right now. Most Part D drug cards have a deductible, all have cost sharing, all have the coverage cap or donut hole, and all have catastrophic. You are moving from one phase of this card to the next based on the accumulated retail cost of the drugs, not what you're spending out of pocket. And as you hit these dollar points, you're moving into the next phase of the drug card. The amount you spend is notated here in dark blue. And the amount you spend will vary depending on what part of this drug card you're in. Once you spend over $9,038.75, I wish they would make them round numbers, but they don't, you go into what's known as catastrophic, and you wouldn't pay any more than 5%. But, you know, you're spending a lot of money at that point. Okay. Why should someone buy a Part D drug card? Even if you don't take drugs, for every month that you go without drug coverage, that you should have had a drug plan, the government is racking up penalties against you behind the scenes. It is 1% of the average, national average drug card. The national average for a drug card is about $35 per month. So you can figure for every month you go without, it's 35 cents. So you go a month without, it's 35, 70, $1.05, $1.40, and so forth. And then you can only get, if you don't get it when you're supposed to get it, then you can only get a drug card during open enrollment. So it's not like you go, all right, today I realize I need it, I'm gonna go get it. If it's not open enrollment, you're still gonna have to wait. And so I'll give you an example. I had a lady that found out about me. She wanted to change her supplement, which we did. And she said, I'd like to buy a drug card. I said, why don't you have one? I said, well, I don't take any drugs, but I'd like to buy a drug card now. So she didn't buy one for 5 years. So if you take 35 cents and you times it by 60 months, that's $21. And she pays a $21 penalty every month for the rest of her life on top of what anything else costs. So two things. One, even if you don't take any drugs, you should still get a drug card. One, there are some that are very inexpensive, as little as $13 or $14 a month, and it keeps you out of the penalty, and you may end up with a drug that you need coverage for. So it's important to take one or to get one. But again, you're buying it based on the overall out-of-pocket cost. You're not looking at any one of those specific costs and making a judgment call based on that.
Hey,
All
Steve,
right.
we have a question that relates to that a little bit. So how do I find out how much Medicare will cover for my expensive disease? I want to know before I retire.
Okay. What I would suggest is if you want to contact me, we can figure that out to a large degree. So depending on, I'm trying to break this down a little bit. Inpatient care, not a problem. Outpatient care, not a problem. Drugs could be a problem depending. If you're getting a drug administered by someone else, that is going to be covered under Part B, which is good for you because you'll have very little out of pocket. If you're taking medication yourself, that's going to be covered under Part D. And the only way we would know for sure is when we meet with someone, or before we meet with someone, we ask them to fill out some forms, which includes the drugs that you're currently taking. We want to know the dosage and the frequency. What we do with that information is we go onto Medicare.gov's website, we input the information, and we figure out which are the top 3 drug cards for you. And then we provide that information to the client. And so what we can figure out is what the premium is going to cost and what your out of pocket is going to be for the drug. So you'll know that ahead of time. Okay? Any other questions? Matt, anything else?
Yeah, there's a follow-up. Is there a government tax on Part D premiums for people who have higher incomes? And does that change the analysis of just having a cheap $13 drug plan?
Yes, good question. So if you're married, it starts at $174,000, and there are multiple tiers, and the amount you spend depends on how far over that $174,000 that you go. And it's called IRMA, Income-Related Monthly Adjustment. So what happens is the government is looking at your income from 2 years prior to the year that you go on Medicare. It is a rolling look at your income with a 2-year delay. It is not uncommon for someone to say, you know, look, I was making, let's pick a figure, $300,000 a year. And now this year I'm retired and I'm making $100,000, but the government's taxing me based on what I was making when I was working. So once you get assessed, the income-related monthly adjustment, there is an appeal form, and I have numerous clients that have been successful at appealing their income-related monthly adjustment, saying that, look, I don't make that much money now, and so I shouldn't be charged that amount of money. So, and for some people, even in retirement, they may be paying that amount of money. And if you're someone in that situation and you're taking a couple of generic drugs, you might want to go without drug coverage in that case. I have several clients that have done that because you can get out of paying the income-related monthly adjustment for the Part D as well as the drug premium for Part D. And again, that's if you're taking a few inexpensive drugs. We'd have to figure that out, which we can do. Any other questions? Now you guys are really it.
Nothing coming in right now.
No? Okay. So again, it's important to get drug coverage because you just don't know what's going to happen. So it is, when you're working, it is generally, mail order is generally going to be cheaper than when you buy the drug retail. In the Medicare world, that does not always happen that way. Sometimes mail order is actually more expensive than buying it at your local retail store. And by the way, that is something that we figure out for you as well. So that's all I really have for the moment. Is there a question?
Hey, Steve, so in the last slide, you had the donut hole, and I know that's confusing to a lot of people. Can you just explain the donut hole, what it is?
Yeah. So after you spend in retail costs $4,020, so once you're over that threshold, you go into what's known as the coverage gap or donut hole. Now, the way it's structured now, you would pay, if you notice, the blue is consumer, and that means that you could pay as much as 25% for a brand, as much as 25% for a generic. It was higher than that a few years ago, but the government was slowly reducing the cost down. I don't know that it's going to be reduced any more than that, but they got it down to the same as the cost sharing, which is also 25%. So it's basically like a discount plan once you hit that $4,000. Once you spend between $4,000 and $9,000 of retail drug costs, that's when you go into catastrophic and you can't spend more than 5%. Does that answer the question?
Yep. Thank you.
Okay. So little bit about us. So DelVal Senior Advisors, there's myself, I own the company. We have several other advisors. And people, well, nobody's really coming in at this point. We're doing it virtually. But we would normally, if someone's interested and calls us, we would send out an email with a couple of links we ask you to complete. We want to know all the medications you're on, the dosage and frequency. And there's another form where you are agreeing to talk about certain subject matters. Medicare requires that. It's all done electronically. We get that information, and there's everything that we need to put something together. We do put a plan together for you. Either myself or somebody else would call you. We would set up a time to either Zoom or do it over the phone, your preference. Either way, we send you a PDF of what we're going to review. We usually spend somewhere between an hour and a half reviewing this. What's different about what we're doing one-on-one versus this is we would talk about specific companies and rates, and I can make a recommendation, which I can't do in an educational seminar. And then it's up to you what you want to do. But what we try to do is make it as easy as possible. We have the forms if you need them to enroll in Medicare. We even have the appeal form if you're looking for that. And our job, again, is just to make it as easy as possible. So, go ahead.
We have another question come in. What do you charge for the services?
Good question. Zero. So how do I get paid? I am getting compensated directly from the insurance company. The rates are the rates. Whatever rates the insurance companies give me, I'm going to give to you, and they're the same rates that anybody else has. You're paying for me whether you use me or not. It's just built into the rate. So you don't pay me a thing. We're getting compensated directly from the insurance company. And by the way, in the presentation that you would see one-on-one, we actually address that.
So, and Steve, so if they went, if someone went online and picked out a plan themselves, they would get the same pricing as if they went through you.
Some companies you can do that, and others you cannot. Some companies like, well, I don't want to mention any companies, but there are some companies that you can buy direct from them, or you can buy from me. The price is identical. There is zero difference between them. Okay? Any other questions? This is a quiet crowd. You usually get lots of questions. Usually starts like 2 minutes into this thing.
We have another one.
Okay.
Do you provide your services to residents that live outside of Pennsylvania?
Yes. I personally am licensed in 14 states. So, what state, can I ask what state we're talking about?
Let's see if Connecticut.
I'm actually not licensed in Connecticut, but I certainly could look into it if it's not a big deal in most states to get licensed. Okay. So it's not usually a problem. A lot of the licenses have come from clients that have moved to other states, and then I had to get appointed there.
Okay.
Okay. Any other questions?
I don't think so. I think we exhausted it.
It's time for dinner, I guess.
Not out.
All right. So I'm sorry.
Are you licensed in Missouri?
God, I'm licensed in 14 states. I hit 2 of them that I'm not. I'm not licensed in Missouri. I'm licensed in Iowa, and Arkansas, and Utah, and several others. But no. But again, it's not. I could easily do that.
Got it. All right.
What I did, and the reason you're looking at this screen with my contact information on it, is the first page does have it, and I was told that people couldn't read it, so I made a larger version of it. So if you wanted it, if you wanted my contact information, it would be easier to read. So that's why you're looking at this screen.
All right.
So again, if there are no other questions, I want to thank everybody for their time today. And feel free to reach out to me if you have questions. You don't have to have Medicare imminent. It could be, I have people that come to me a year, 2 years away, but just want to try to investigate this thing so they have a better idea when it comes up. So I encourage you to do that if you like. Again, thank you for your time. And Matt, thank you for inviting me today. I appreciate it.